poor of Haiti live their lives in a daily struggle for survival. They are located only 90 minutes from Miami, Florida, yet live in absolute poverty and inhuman living conditions. My name is Marilyn Lowney, and I'm the director of the Haitian Health Foundation, what we call HHF, a charity started by my family in the early 1980s. I first visited Haiti when I was only 14 years old. The dehumanizing conditions I saw on those early trips made a profound impact on my life. I sometimes find it difficult to explain the reality of Haiti without turning to statistics. This is a country where 80% live in poverty, making about $1 a day. We see the faces behind the statistics, the desperation of the women who would try to put their babies in our backpacks, hoping we would take them to the U.S. and out of the misery. How do I explain this day-to-day survival existence where people have little food, no running water, no electricity, no toilets, little education? There are none of the basics that we take for granted. No matter the poverty in the United States, it just cannot compare with the poverty of Haiti, where there is no welfare, no food stamps, no safety nets. Most Haitians live in hovels made of banana leaf, thatch, and scraps of tin, with leaking roofs and mud floors. Vermin like rats and cockroaches run freely in and out. These houses are so poor, if we housed our animals in them in the United States, we would be arrested for cruelty to animals. Even basic health care is a luxury. The average life expectancy is only 50 years old. Maternal and child mortality is very high. Haiti is a land where children starve to death, where intestinal worms are the norm, where children root through garbage dumps for even the smallest scraps of food. People live with constant hunger and continual threats to their health, from killers like diarrhea, pneumonia, malaria, hepatitis, and tuberculosis. HHF provides health care, development, and relief to 225,000 people in over 100 rural mountain villages. From the start, we have always concentrated on women, recognizing the multiplier effect of educating and empowering women. Women are agents of change. Haiti has a matriarchal society, and families depend on the mother and grandmother. They are the glue holding the family together. It's estimated that a woman will return 90% of her income to support her family, whereas a man will return only 30%. Indeed, the death or disability of the mother has a catastrophic impact on the entire family. When a woman dies in labor, fewer than 10% of surviving newborns live to celebrate their first birthday. Dining for Women's support of HHF can help change this picture. A gift of $15,000 will provide health care for over 3,000 villages through our Adopt a Village program, safe pregnancies and deliveries for 10 women and their babies at HHF Center of Hope, and 33 goats for indigent women living in the mountains of Haiti. The first program, Adopt a Village, brings health care and health education to a destitute rural village through the use of local resident health agents trained by HHF. Because of the high illiteracy in Haiti, it is not possible to hand out books with health lessons. Instead, HHF educates through songs, skits, and stories created by the villagers themselves. There is a song, for example, about combating diarrhea, one about the importance of breastfeeding, and so on. From our beginnings, HHF health agents work to create mothers' clubs in the villages, groups of women who meet regularly to discuss what they see as challenges and to discuss solutions that will work in their culture. These are not women who are looking for welfare, but for the opportunity to work towards a better life for themselves and their children. HHF's goal is to empower these women to create their own change, not to enforce changes from the outside. HHF currently cares for the very poorest in over 100 rural villages, some up to an 18-hour walk from our facilities. Imagine having to walk 18 hours to get to a doctor. Instead, the village health agent lives and works right in the village, providing immediate care. Your support of the Adopt a Village program will provide improved health for at least 3,000 destitute people. Our second appeal to Dining for Women is for support of at-risk pregnant women. 90% of Haiti's births occur in the ramshackle, mud floor hovels people call home. If a woman experiences crisis during labor, she must either walk for hours or be carried on a crude chair ambulance. This often becomes a death walk for the woman and her baby. HHF Center of Hope is a safe, clean, inpatient facility for women in high-risk pregnancy. At-risk women are identified by HHF health staff and transported by ambulance to the center, which provides medical care and good nutrition while the woman awaits delivery. The cost for each woman, including medicine, food, and a birthing kit, is approximately $500, a small price to save 2 or more lives. The center admits several hundred at-risk pregnant women and malnourished children annually, and nearly 9,000 women receive outpatient prenatal care each year. The final program I will tell you about is our Give a Goat program, which provides pregnant breeding goats to indigent rural women. The offspring are used to barter for food, tuition for children, rent, etc. Women use the manure to fertilize gardens, and the male goats, which have little economic value, are slaughtered and eaten. They provide an excellent source of protein. The villagers themselves choose the goat recipients, ensuring that the animals go to those who are the most needy. This democratic process empowers the community to participate in decision-making and community building. I've outlined just a few of the services provided by HHF. I encourage you to visit our website to fully appreciate the full scope of our outreach. Every program is focused on women's health and women's empowerment. Dining for Women members are also welcome to visit our facilities in Haiti to meet the women behind the statistics. As you consider your donation, be assured that our overhead is only 8%. 92 cents of each dollar goes to services for the poor. We have been a 4-star charity on charitynavigator.org for 3 years, the highest designation, for low overhead and excellent fiscal responsibility. Thank you again for giving me the opportunity to tell you about our outreach to the women of Haiti. Please help us to celebrate these strong women of Haiti, full of joy and resilience, even as they struggle to feed their children and improve their lives.
Thank you.